This video is about chronostasis. Chronostasis means phantom timekeeping. That means delayed vision awareness. Delayed visual awareness. You can say like that. Consider I'll say. Have you ever seen when you're trying to look at your wall clock, you'll you'll try to look at the wall clock for a fraction of a second. You'll just see here, and you'll notice sometimes for 1 or 2 seconds you will be glancing at the watch, and you will be noticing that the seconds needle, the seconds needle that will not be ticking, that will be stationed at a particular number. Have you ever noticed that? Can you understand what I'm saying? Suppose if you are looking at the wall clock, you are looking at the 3 pins or 3 needles inside that. In that seconds needle, that will be at a particular number, and you will be noticing for 2 or 3 seconds continuously, you will be noticing that, or you will be feeling that the needle is in the same time or same number for a particular 2 or 3 seconds. Have you ever noticed that? You will think that whether the watch is really working or not, whether it is frozen already, I don't know, like that you will be thinking. Have you ever noticed that? Actually, this is completely normal. This one is called chronostasis. What actually happening is when a human body or human eye is human eyeball is moving from a particular point A to particular point B, the eyeball is moving from that particular point A to B. That is the logic. Here, when that is happening, all of a sudden, that means very fast or quick, sudden movement of eyeball. So when you are looking at the watch like this, all of a sudden, very fast. So this is quick eyeball movement. That one is called saccade. Saccade. Okay. So when you are doing that particular quick eyeball movement from point A to point B, logically speaking, the brain, the perception of the vision should be from A to B. But the time given for that eye to perceive the vision is very short, maybe within fraction of second. That is very short period of time, so that the brain cannot perceive that vision from point A in between the vision point from A to B. That means the vision in between from point A to B. It cannot perceive easily because of the short duration of time. So that is called short-term blindness. The brain or the eyes will go for short-term blindness. Okay, so better the eyes or the brain, what it is actually doing, it takes the previously given input of vision. That means from point A, it takes consider into that, and then tries to prolong that particular vision to balance the time period of the perception when you're until when you are moving to point B. So from point A, from here you are looking. From there you are going to move your eyeball to point B. So it perceives the picture what is there in the point A. So it tries to fill the gap from A to B. It tries to fill the gap by means of the same picture, for duplicating the, or by giving some small picturization from A to B until you come to perfect recurrence of perception. So to fill out that area, the brain will actually prolong the picture of from A, point A. So when you are going to move your eyeball from A to B, okay, all of a sudden, so that brain will give the picture where it is already taken from A. So sometimes it may be prolonged little too further, and it will not happen reverse all of a sudden. So it will be like the picture has stationed already. So nothing is moving like that. After 2 or 3 seconds, the eyeball will come to the normal perception, or the brain will perceive normally. After 2 or 3 seconds, it will work normally. So until then, it will be in the same scenario of what it has already perceived from point A until to the point B. So this is what happening when you are actually looking at the wall clock all of a sudden. So this phenomenon is called chronostasis. That means the phantom time keeping. That means time is kept constant and it is phantom. Okay, thank you.